In a move that has sent shockwaves through the United Kingdom, Prime Minister Keir Starmer has announced the abolition of NHS England, aiming to bring the health service under direct governmental control. This decision, intended to streamline operations and reduce bureaucracy, has ignited a firestorm of debate. Given the government's recent history of policy reversals and unmet commitments, the public's skepticism is palpable. Is this bold move a genuine effort to revitalise the NHS, or should citizens brace themselves for further disappointment? Before we dive into the details, make sure to hit that like button and subscribe to the channel so you stay updated on the latest developments that impact your everyday life. Let us know in the comments what you think about this decision. Do you trust the government to fix the NHS? Now let's get into it. One of the biggest issues with this announcement is the sheer confusion it has caused among the public. Many people initially believed that the entire NHS was being abolished or fundamentally changed overnight. However, the distinction is important. The NHS, National Health Service, is the entire publicly funded healthcare system in the UK, covering hospitals, general practitioners, ambulance services and more. NHS England, on the other hand, is the governing body that oversees how the NHS operates in England. It manages funding, sets priorities and implements policies. So when the government announced that NHS England was being abolished, what they meant was that its administrative role would be absorbed back into the Department of Health and Social Care, rather than functioning as an independent agency. But for the average person, especially those who don't closely follow politics, this news created widespread panic. Many feared hospital closures, loss of free healthcare, and even privatization, all of which have been contentious issues in recent years. The government's decision to dissolve NHS England is framed as a strategy to eliminate red tape and redirect funds to frontline services. Health Secretary Wes Streeting emphasised that this move would save hundreds of millions a year, which could be utilised to reduce waiting times and improve patient care. The plan involves cutting approximately 9,000 jobs, with the aim of reducing duplication and inefficiencies within the system. However, this announcement has been met with a mix of cautious optimism and outright skepticism. Critics argue that such a significant restructuring could lead to disruptions in service delivery. The British Medical Association and other healthcare unions have expressed concerns about potential job losses and the impact on patient care during the transition period. For nurses and doctors already stretched beyond their limits, this announcement feels like yet another bureaucratic shake-up that does little to address their real concerns. Imagine being a nurse working 14-hour shifts in an understaffed hospital, struggling to keep up with patient care, only to hear that thousands of jobs are being cut from the administration. Instead of feeling reassured, many frontline workers fear that this will create even more paperwork, delays in pay and additional stress, all while they continue to be overworked and underpaid. The responsibility for this monumental decision rests squarely with the current government. Prime Minister Starmer and Health Secretary Streeting have championed this reform as a necessary step to rectify what they describe as a fragmented and inefficient system. They argue that bringing the NHS under direct ministerial control will enhance accountability and streamline decision-making processes. Yet this move also serves as a stark admission of past policy failures. The 2012 Health and Social Care Act, introduced by a previous administration, established NHS England as an independent body to reduce political interference in healthcare. The current government's decision to reverse this structure suggests a recognition that the previous reforms may have contributed to the current challenges faced by the NHS. The public's apprehension is not unfounded. Over the past year, the government has made several policy announcements only to backtrack under public pressure or due to unforeseen complications. For instance, the controversial decision to means test the winter fuel payment faced significant backlash, leading to legal challenges and a notable dip in public approval ratings for the Prime Minister. Such instances have eroded trust in the government's ability to implement effective policies without adverse consequences. The NHS is a cornerstone of British society, providing healthcare to millions. Any changes to its structure have profound implications for every citizen. The proposed abolition of NHS England raises critical questions about the future of healthcare delivery in the UK. Will this restructuring lead to improved services, or will it result in further bureaucratic entanglements and reduced quality of care? For those already waiting months for specialist appointments, the fear is that this shake-up will only make delays worse. If the administrative transition leads to mismanagement, errors in scheduling, or payment issues for medical staff, patients could see even longer waiting times, fewer available doctors, and more exhausted nurses struggling to keep up with demand. To navigate this complex situation, the government must prioritise transparency and engage in meaningful consultations with healthcare professionals and the public. Clear communication about the intended benefits and potential risks of this reform is essential to rebuild trust. Additionally, learning from past missteps is crucial. Implementing a phased approach to the restructuring, with continuous evaluation and willingness to adapt based on feedback, can mitigate potential disruptions. Ensuring that cost savings are genuinely redirected to frontline services as promised will be vital in demonstrating the government's commitment to improving the NHS. Most importantly, nurses, doctors and hospital staff must be heard. If the government wants to convince healthcare workers that this change is for the better, it needs to address pay disputes, staffing shortages and working conditions, not just make broad promises about efficiency. The decision to abolish NHS England marks a pivotal moment in the UK's healthcare history. While the intention to streamline operations and enhance patient care is commendable, the government's track record of policy reversals and unmet commitments casts a long shadow. As citizens, it is imperative to remain vigilant, informed and engaged in the discourse surrounding these changes. The future of the NHS, a pillar of our society, depends on our collective scrutiny and advocacy. If you found this analysis insightful, please like this video and subscribe to our channel for more in-depth discussions on critical issues affecting our nation. Do you think this reform will benefit the NHS, or are you concerned about the potential risks? Let us know in the comments. Your voice matters, and together we can navigate these challenging times.